Another day, another story. Please subscribe and like at 365 How. Salt intake can influence blood pressure levels in some individuals. Here's how salt and blood pressure are related. 1. Sodium and blood pressure. Salt, or sodium chloride, contains sodium, which plays a role in regulating fluid balance in the body. When you consume salt, the kidneys retain water to maintain proper fluid balance. This increased fluid volume can lead to higher blood pressure. 2. Hypertension. High salt intake has been linked to hypertension, high blood pressure, in some individuals. Hypertension is a significant risk factor for cardiovascular diseases such as heart disease and stroke. 3. Some individuals are more salt sensitive, meaning that their blood pressure is more strongly influenced by salt intake. Others may have a lower sensitivity to salt. 4. Dietary guidelines. Many health organizations, such as the World Health Organization, WHO, and the American Heart Association, AHA, recommend reducing salt intake to help manage blood pressure and overall cardiovascular health. These organizations generally suggest limiting daily sodium intake to less than 2,300 mg, mg, or even lower for certain populations, e.g., individuals with hypertension, older adults. Other lifestyle factors, such as overall diet, physical activity, weight management, stress levels, and genetics, also play a role in blood pressure regulation. To reduce salt intake and manage blood pressure. 1. Read food labels. Be aware of hidden sources of sodium in processed foods and condiments. Many packaged and restaurant foods contain high levels of added salt. 2. Cook at home. Preparing meals at home gives you better control over the amount of salt used in cooking. Experiment with herbs, spices, and other flavorings to enhance the taste of your dishes without relying heavily on salt. 3. Choose low-sodium options. Opt for lower-sodium versions of packaged foods when available. Look for labels indicating reduced sodium or no added salt. 4. Increase potassium intake. Consuming potassium-rich foods, such as fruits, bananas, oranges, vegetables, leafy greens, potatoes, and legumes, can help counterbalance the effects of sodium on blood pressure. 5. Moderate processed and fast foods. These types of foods tend to be high in sodium. Limit their consumption and focus on whole, unprocessed foods as the foundation of your diet. 6. Consult with healthcare professionals. If you have hypertension or other health conditions, it's important to work with your healthcare provider or a registered dietitian who can provide personalized advice and guidance regarding salt intake and blood pressure management. It's worth mentioning that reducing salt intake should be part of an overall healthy lifestyle that includes a balanced diet, regular physical activity, and other recommended measures for managing blood pressure and promoting cardiovascular health. If you like the video, please subscribe and like at 365 How.